Magandang araw po sa ating lahat. Again, this is our everyday drill practice question and rationalization, and this time we will talk about prenatal period practice questions for board exam. Okay, wala nang intro. Let's start. Number 1. The nurse is providing instructions to a pregnant client who is scheduled for amniocentesis. What instruction would the nurse provide? A. Strict bed rest is required after the procedure. Letter B. Hospitalization is necessary for 24 hours after. Letter C. An informed consent needs to be signed before the procedure. And letter D. A fever is expected after the procedure because of the trauma to the abdomen. Ano po sagot natin dito? In 3, 2, 1. Ang sagot po natin dito is letter C. An informed consent needs to be signed before the procedure because amniocentesis is an invasive procedure and informed consent needs to be obtained before the procedure. Okay? So, strict, letter A, tignan natin yung letter A, strict bed rest is required after the procedure. It's not necessary po na strict bed rest. So, mali po ang ating letter A. Letter B, hospitalization is necessary for 24 hours. It does not need for hospitalization po. And, yung letter D naman, a fever is expected after the procedure because of the trauma to the abdomen. Ibang usapan na naman po yan. Kaya, ang sagot natin is letter C. Tandaan po natin, before amniocentesis, before scheduled for amniocentesis, kailangan po ng informed consent because this is an invasive procedure. Okay, number 2. A pregnant client in the first trimester calls the nurse at a healthcare clinic and reports noticing a thin, colorless vaginal discharge. The nurse would make which statement to the client? Again, a pregnant client in the first trimester calls the nurse at a healthcare clinic and reports noticing a thin, colorless vaginal discharge, vaginal drainage. The nurse would make which statement to the client? Ano daw ang sasabihin ng nurse? Okay? Letter A, come to the clinic immediately. Letter B, the vaginal discharge may be bothersome but it is a normal occurrence. Letter C, report to the emergency department at the maternity center immediately. And letter D, use tampons if the discharge is bothersome but be sure to change the tampons every 2 hours. Anong sagot natin dito? 3, 2, 1. Ang sagot natin dito is letter B. The vaginal discharge may be bothersome but it is a normal occurrence. Okay po? And tandaan natin, thin, colorless vaginal discharge, normal lang po yan. So, ang sagot natin is, the vaginal discharge may be bothersome but it is a normal occurrence. Alright? So, tignan natin yung letter A. Come to the clinic immediately. Hindi po kailangan kasi nga, normal. And yung letter C, report to the emergency department at the maternity center immediately. Again, parang parehas lang po sa letter A. And the use tampons if the discharge is bothersome but be sure to change the tampons every 2 hours. Tandaan po natin, hindi po tayo gumagamit ng tampons kasi it is risk for infection. Okay po? Again, ang sagot natin dito is the vaginal discharge may be bothersome but it is a normal occurrence. Let's go number 3. A non-stress test is performed on a client who is pregnant and the results of the test indicate non-reactive findings. The primary healthcare provider prescribes a contraction stress test and the results are documented as negative. How would the nurse document this finding? A normal test result. B, an abnormal test result. C, a high risk for fetal demise. D, the need for cesarean section. Ang sagot natin dito is letter A. Normal lang po. Pag na-document po as negative, normal po yung test result. Number 4. A rubella titer result of a 1-day postpartum client is less than 1/8 and a rubella virus vaccine is prescribed to be administered before discharge. The nurse provides which information to the client about the vaccine? Select all that apply. Again, a rubella titer result of a 1-day postpartum client is less than 1/8 and rubella virus vaccine is prescribed to be administered before discharge. The nurse provides which information to the client about the vaccine? Select all that apply. A. Breast or chest feeding needs to be stopped for 3 months. B. Pregnancy needs to be avoided for 1 to 3 months. C. The vaccine is administered by subcutaneous route. And letter D. The exposure to immunosuppressed individuals needs to be avoided. E. A hypersensitivity reaction can occur if the client has an allergy to eggs. Letter F. The area of the injection needs to be covered with a sterile gauze for 1 week. Ano sagot natin dito? Okay. 5, 4, 3, 2, 1. So, ang sagot natin dito is letter B, C, D, and E. Okay? Basahin natin yung mga sagot. Pregnancy needs to be avoided for 1 to 3 months. And letter C, the vaccine is administered by subcutaneous route. Letter D, exposure to immunosuppressed individuals needs to be avoided. And letter E, a hypersensitivity reaction can occur if the client has an allergy to eggs. Okay, basahin nga natin yung rationale. Rubella vaccine is administered to those who have not had rubella or who are not serologically immune. The vaccine may be administered in the immediate postpartum period to prevent the possibility of contracting rubella in the future pregnancies. The live attenuated rubella virus is not communicable in breast milk. So, mali ang ating letter A. Breast or chest feeding does not need to be stopped. The client is counseled not to become pregnant for 1 to 3 months after immunization or as specified by the obstetrician because of possible risk to fetus from the live virus vaccine. The client must be using effective birth control at the time for the immunization. The client needs to avoid contact with immunosuppressed individuals because of their low immunity toward live virus and because the virus is shed in the urine and other body fluids. The vaccine is administered by subcutaneous route. And a hypersensitivity reaction can occur if the client has an allergy to eggs because the vaccine is made from duck eggs. Excuse me. There is no useful or necessary reason for covering the area of the injection with a sterile gauze. Mali din ang ating letter F. Okay? So, ang sagot natin dito, pregnancy needs to be avoided for 1 to 3 months. Letter B yan. And letter C, the vaccine is administered by the subcutaneous route. Letter D, exposure to immunosuppressed individuals needs to be avoided. And letter E, a hypersensitivity reaction can occur if the client has an allergy to eggs. Number 5. The nurse in a healthcare clinic instructing a pregnant client how to perform cake counts. Which statement by the client indicates a need for further instruction? Hanapin natin kung ano yung kailangan ng further instruction or yung mali. Letter A, I will record the number of movements or kicks. Letter B, I need to lie flat on my back to perform the procedure. Letter C, if I count fewer than 10 kicks in a 2-hour period, it could be because my baby is sleeping. Letter D, I need to place my hands on the largest part of my abdomen and concentrate on the fetal movements to count the kicks. Anong sagot natin dito? In 5, 4, 3, 2, 1. Ang sagot natin dito is letter B. I need to lie flat on my back to perform the procedure. Hindi po dapat naglalay flat on the back habang ginagawa yung procedure. Okay? The client would sit or lie quietly on the side to perform kick counts. Lying flat on the back is not necessary to perform this procedure and it can cause discomfort and presents a risk of vena cava supine hypotensive syndrome. Okay? So yung letter A, I will record the number of movements or kicks. Tama po yan. And letter C, if I count fewer than 10 kicks in a 2-hour period, it could be because my baby is sleeping. Tama, mali? Tama, di ba? And letter D, I need to place my hands in the largest part of my abdomen and concentrate on the fetal movements to count the kicks. Tama, tama din po yan. So, ang sagot natin dito is letter B. Number 6. The nurse is performing an assessment of a pregnant client who is at 28 weeks of gestation. The nurse measures the fundal height in centimeters and notes that fundal height is 30 cm. How would the nurse interpret this finding? Letter A, the client is measuring large for gestational age. Letter B, The client is measuring small for gestational age. Letter C. The client is measuring normal for gestational age. And letter D. More evidence is needed to determine size for gestational age. Anong sagot natin dito? Okay, 5, 4, 3, 2, 1. Ang sagot natin dito is letter C. The client is measuring normal for gestational age. During the second and third trimesters, week 18 to 30, fundal height in centimeters approximately equal to the fetus age in weeks plus 2 centimeter. Diba? Sakto lang. 28 weeks plus 2 centimeter magiging 30 cm. Okay? Therefore, if the client is at 28 weeks gestation, a fundal height of 30 cm would indicate that the client is measuring normal for gestational age. Gets? Sagot natin is letter C. Normal lang po yan. At 28 weeks of gestation, 30 cm. Let's go to number 7. The nurse is performing an assessment on a client who suspects being pregnant and is checking the client for probable signs of pregnancy. The nurse would assess for which probable signs of pregnancy. Select all that apply. A. Ballottement or baloma. Letter B. Chadwick sign. Letter C. Uterine enlargement. Letter D. Positive pregnancy test. Letter E. Fetal heart rate detected by a non-electronic device. And letter F. Outline of fetus via radiography or ultrasonography. Okay? So, anong sagot natin dito? Ang sagot natin dito is letter A, B, C, and D. A. Ballotment. Ballotment. Letter B. Chadwick sign and uterine. Chadwick sign, uterine enlargement, positive pregnancy test. Okay? Yung letter E and letter F, positive na po yan. Bakit? Paano natin nasasabing positive na? Dito, think of baby. This is definite diagnosis for pregnancy kasi naririnig mo na talaga yung fetal heart rate and outline of fetus via radiography or ultrasonography. Yung baby na talaga. Yung baby na talaga ang evidence diyan. Okay? So, dun sa presumptive, it is a subjective, not a definite diagnosis for pregnancy. Think sa mother. Siya mismo yung nagsasabi. It is subjective. Halimbawa, nausea, 'di ba? Yung mother mismo yung nagsasabi. It is subjective. Nausea, really tired, absent of period or amenorrhea, enlarged breast, 'di ba? Yung mother mismo yung nakakapansin. Think of mother. Gets? Sa presumptive. And sa probable naman, ito is sa probable naman, ito is objective. Isipin nyo yung doktor na dito. Ito na yung mga test na ginagawa. Pregnancy signs that the nurse or doctor can observe. Okay? Again, pregnancy signs that the nurse or doctor can observe. Probable. At ito na yung mga ballotment, Chadwick sign, uterine enlargement, positive pregnancy test. Number 8. A pregnant client is seen for a regular prenatal visit and tells the nurse about experiencing irregular contractions. The nurse determines that the client is experiencing Braxton Hicks contractions. On the basis of this finding, which nursing action is appropriate? Letter A. Contact the primary healthcare provider. Letter B. Instruct the client to maintain bed rest for the remainder of the pregnancy. Letter C. Inform the client that these contractions are common and may occur throughout the pregnancy. Letter D. Call the maternity unit and inform them that the client will be admitted in a preterm labor. Anong sagot natin dito? Number 8, ang sagot natin is letter C. Inform the client that these contractions are common and may occur throughout pregnancy. Okay? Braxton Hicks contraction, normal lang po yan, and it doesn't need bed rest for the remainder of the pregnancy. No need for contacting the primary healthcare provider, and no need na din for calling the maternity unit and informing them that the client will be admitted in a preterm labor condition. Okay? Dito, inform the client that these contractions are common and may occur throughout the pregnancy. It is common lang po. Braxton Hicks contraction, common and may occur throughout the pregnancy. Okay? Sagot natin, letter C. Number 9. The client arrives at the clinic for the first prenatal assessment. The client tells the nurse that the first day of the last normal menstrual period was October 9, 2023. Using Nagel's rule, which expected date of delivery would the nurse plan to document in the client's chart? Okay. Tandaan natin yung rule sa Nagel's rule, minus 3 plus 7 plus 1. Minus 3 sa month, plus 7 sa day, and plus 1 sa year. Okay? Anong sagot natin dyan? Minusan natin yung October 10 minus 3, 7 magiging July. And yung plus 7 sa 19 is magiging 26. And plus 1 sa 2023 magiging 2024. So, anong sagot natin dyan? Number 9, ang sagot natin is letter B. Tandaan natin yung Nagel's rule, minus 3 plus 7 plus 1. Minus 3 plus 7 plus 1. Minus 3 sa month, plus 7 sa day, and plus 1 sa year. Except kung yung LMP niya is January, February, March. Okay? Minus plus 9 na yun kapag sa year. Gets? Number 10. Sorry, umubo po tayo ngayon. Number 10, last na to. Last muna to. The nurse is collecting data during an admission assessment of a client who is pregnant with twins. The client has a healthy 5-year-old child who was delivered at 38 weeks and tells the nurse that there is no history of any type of abortion or fetal demise. Using GT-PAL, what would the nurse document in the client's chart? Anong sagot natin dito? Gravida. The client is pregnant daw with twins. Pero ika-count lang natin yun ng 1. Okay? Pregnant with twins. Huwag tayong malilito. Pag twins, counted lang yun as 1. Assessment of a client who is pregnant with twins. 1 na yung gravida. The client has 5-year-old child who was delivered at 38 weeks and tells the nurse that there is no history of type. Okay? So, plus 1 again kasi meron siyang healthy 5-year-old child. So, yung gravida na natin is 2. Yung term natin, yung T. Gravida 2. Yung term natin or yung T is 1 kasi 38 weeks na ipinanganak yung healthy year-old na child niya. And yung preterm, wala namang nabanggit na preterm kaya 0. Yung abortion, 0 din kasi walang nabanggit na in-abort. And living, of course, 1 kasi meron yung 5-year-old child. Okay? Huwag natin kakalimutan yan. Very common sa board exam. GT-PAL. So, you have reached the end of the document. Dito muna tayo magtatapos, guys. And see you next time. Thank you for watching. And God bless us all.